Head teachers say they might not be able to reopen primary schools in England in just 3 weeks' time, in line with the Prime Minister's ambition. Schools are expected to limit class sizes to 15 children, to stagger breaks, and to accept that strict social distancing will not always be possible. Our education correspondent Elaine Dunkley has been visiting one school in Bootle.
This is All Saints Primary in Bootle in Liverpool. Teachers are having a staff meeting to prepare for the school reopening. In just over a few weeks, 168 children could be back in the classrooms.
Walking in and out, how do we control after school as well?
Head teacher Mrs Holleran will now have to ensure that teachers and pupils will be safe.
Children at this age do not understand social distancing. I'd be very surprised if any of them did. We would really struggle with, I would say, 5 children in this space.
The government has outlined in its guidance how schools can manage the risk of spreading coronavirus. Hygiene will be a priority. Schools will need to be stocked with hand sanitizer, children will frequently need to wash their hands, and teachers will be constantly cleaning the surfaces where children learn and play.
A lot of the things that we do in Earlies are practical resource-based activities, so the children touch everything. Making sure that we are also cleaners and we are also toilet supervisors is going to be very difficult, as well as trying to make sure the curriculum is taught as well as it can be.
The Department for Education has highlighted a number of ways to minimise contact between children.
This is our canteen. As you can see, a confined space. So staggering lunches would present us with a great challenge. It would take up the best part of the day, to be honest.
The government says the decision to send children back to school is based on scientific advice and safety is a priority. Bootle is in one of the most deprived areas in England, and there is concern the longer schools are closed, the wider the attainment gap between poorer children and their more affluent peers.
The gains that we've made over the last 10 years in narrowing the socio-economic gap for attainment could be as much as reversed due to coronavirus. So catching up is going to be fundamental, particularly for disadvantaged young people.
These are testing times. In less than 3 weeks, the government wants children to return to classes.
That in my bones I cannot feel assured is safe.
The coronavirus pandemic is one of the biggest challenges that schools have ever faced. Elaine Dunkley, BBC News in Liverpool.
Recovery for those who have suffered the worst effects of coronavirus is a prolonged process, both physically and mentally. Men are more than twice as likely to need intensive care than women, and around half of all those who go into intensive care survive. Our medical correspondent Fergus Walsh has been to University College Hospital in London to meet some patients at the start of their rehabilitation.
You're feeling tired. All right. Okay.
Slowly, delicately, patients almost broken by coronavirus are being restored.
Jake, we're going to have a little roll over to the other side now.
Jake, who has a heart condition and diabetes, spent 3 weeks on a ventilator. It was touch and go whether he'd survive.
And my chances were, I think, very, very low.
He's still so weak, getting him into a chair is far from easy. But it's an essential part of his rehabilitation at University College Hospital in central London. Jake still has a tracheostomy, an opening in his windpipe, which used to be attached to a ventilator.
My understanding is the recovery works in the very small steps.
I'm just going to get you fully in a chair position now. Lovely.
I'm not going to give up. Another chance.
You do high five.
I was given a chance, and I'm not going to waste it.
Psychologically, has it been difficult?
Now that I know that I will go back to my family, go back to work, go back to the normal routine, I think psychologically I'm much, much stronger.
Jake, who's 55, hasn't seen his wife Natasha and 17-year-old daughter Emily for over a month, except via video.
Every time the doctor will call me, they will say he's not out of danger. It was the hardest time of my life.
So me and Mum find it rather difficult, so it's absolutely brilliant. I'm over the moon to see him at least once a day on video call.
Yeah, well done.
Physios, occupational and speech therapists, dietitians, health psychologists. There's a huge team involved in rehabilitation.
A lot of physical rehab because they've got a lot of weakness, and then there's the cognitive impact as well. So the delirium that comes from being in an intensive care unit, the confusion that comes with being asleep for many days and waking up to the reality of all of this. So yeah, it's huge.
Up and down. All right. Can you feel your feet on the floor?
Eddie is struggling with the impact of COVID-19 on mind as well as body. He's just emerged from intensive care after a month on a ventilator.
I'm 66 years old, and I felt nearest to death than anything else with this coronavirus.
Do you think you can reach to touch my hand?
As well as physical therapy, he will need psychological support.
Hallucination-wise, so many terrible things that you think are real. Even when you wake up, you think they were real, that you lived through them.
Do you mind telling me what sort of things you were imagining?
I've got a little bit of plot where my dad was buried, and I could see the grave ready there for me to go in there. I said, come, you have to come in there. It's ready for you.
Simply surviving intensive care after this disease is quite an achievement. But the legacy of coronavirus will be felt by many patients like Jake far into the future. Fergus Walsh, BBC News.
The physical and mental burden of recovering from the effects of coronavirus. That was Fergus Walsh reporting there.